Now that you have found, evaluated, distributed and embedded the evidence into practice, the next step is to utilize it. By implementing evidence into organizational systems, practice change occurs, which in turn needs to be evaluated. This process is known as evidence utilization. There are multiple JBI resources included in this step. The Joanna Briggs Institute Practical Application of Clinical Evidence System, or JBI PACES, is a user-friendly online tool that makes it easy to conduct efficient, time-saving audits in small or large organizations. PACES also enables users to compare data with other organizations and offers support for a process of change in relation to the use of evidence in practice on a given activity or a process of care. The Joanna Briggs Institute Patient Outcomes Online, or JBI Pool, is an online prevalence database. A prevalence database records the number of times something occurs or is present. For instance, patients having falls or using urinary catheters. To enter PACES, click on the logo. You'll be prompted to log on. This will take you to the welcome page, which lists all active PACES cycles to date and their progress. The menu bar at the top of the page allows you to view active PACES cycles, conduct a new audit, access the user guide, add, edit or delete users, or to log out. By selecting New Audit, you have to decide which type of audit you would like to conduct. There are two options available. The clinician option is designed for smaller scale practice-based users. There might only be one auditor when this option is selected. The organizational or quality improvement option is designed for larger scale use. This differs from the clinician-based audit, as prior to data collection, you and the PACES audit team need to estimate the current level of compliance for the audit criteria, the predicted level of compliance after the change process, and the size of the population to be audited. PACES then automatically calculates the required sample size for the audit. This option requires you to nominate teams of auditors across the organization. The advanced user in the organization is responsible for creating users and nominating teams for conducting organizational audits. To do this, simply select Administration from the top menu bar and follow the instructions. To conduct a clinician-based PACES cycle, simply select an audit topic of interest and click Next. Once the audit topic has been chosen, a team to conduct the audit needs to be selected. You now have the option to audit all or some of the audit criteria. All criteria are selected by default. If you would like to remove criteria, click on the tick box next to that criteria. To view the source of the criteria, click on the criteria and select View Source. You will need to enter the number of measurements you wish to conduct in the Observations column for each criteria, and then select the date you wish to start data collection. Once chosen, click on Next. You have two options to collect data: printing a hard copy for manual collection or entering data using the PACESmate, a handheld computer. For more information, refer to the user guide. Once data has been collected, a report of the results of your initial audit is developed. If the results comply with best evidence, you've scored 100%, you can choose a new topic to audit. If your results can be improved, you can move to the next part of the program, the GRIP process. The GRIP, or Getting Research into Practice process, deals with identifying reasons why practice is not 100%, referred to as situational analysis. These reasons or barriers can be used to develop an action plan to help improve practice. The action plan details who will be involved in the action process, the strategies or actions you plan to take, the resources you will need, and when you hope to do it by. This is all compiled into a report that can be distributed to all those involved. Finally, another audit is done to find out how well the change process has worked and how closely the clinical practice complies with best practice. A new report comparing the audits is developed. This process can be cycled through again and again as desired, either to keep the change process moving or to check if practice is remaining optimal. Conducting an organization-based audit follows the same process as a clinician-based audit. However, you will be asked to estimate the current level of compliance, the predicted level of compliance after the GRIP process, and the size of the population. This is done in order for the program to work out a sufficient sample size, so your results will have a statistically significant effect. JBI Pool assists your organisation in collecting and visually tracking clinical prevalence data. Prevalence is the total number of an event or disease in a given population at a specific time. Pool can be used to monitor information on falls, wound infections, DVT and more. JBI Pool can be used as a standalone database or in conjunction with JBI Paces. Data is collected at the patient care level and can then be examined at higher levels. Administrators are established for each institution and in turn establish structural levels under them. There are two types of users in Pool: the administrative user and the data entry user. The administrative user is responsible for setting up the structural levels within Pool, and the data entry user is responsible for entering the outcome data. Administrative users can also view all of the organization's data that has been entered for any indicator but cannot change it. Staff who have permission to enter data do so by clicking on the underlined indicator title. A definition of the chosen indicator is provided. The patient's identification number and any subsequent information needed is then entered. Clicking Add Entry transfers the information to the results database. This will then clear the information and allow you to enter another patient's details. If you enter an identification number that has previously been entered for that indicator within your organisation, Pool will alert you to this and ask whether you want to enter this data again. This is to ensure the same patient is not inadvertently added into the database twice. It does, however, give you the option, as a patient may need to be entered in again on another occasion. You're able to edit an entry only on the day it has been entered. To view your results, simply select the appropriate indicator from the View Charts menu. This will take you to the results table for that indicator. The data from the table can be easily exported for use in an Excel format by clicking Export to File. Data can also be presented in chart form and segmented by time period, that is weekly, monthly or 3-monthly. You can also select the date to measure data from until today's date. Importantly, you can select to include the industry average in the chart so that you can compare your unit or organisation's performance against other organisations. Your identifying details, however, are never revealed to others.